Welcome back to Glendale Today. I'm Councilmember Sam Chavira. My guest is Tina Brucato Day, Hospital Administrator of St. Joseph's Westgate. Welcome back, Tina.
Great, thank you.
We did an overview of the hospital in the first segment, and you also talked about the grand opening. I was very impressed with the tour of the medical center, and I'd like those viewers who weren't able to attend the event an opportunity to see it here.
So over here to the right is our cafe. So we have a full service kitchen, so they'll serve our patients and all of our staff and visitors.
We started at the entrance, and the first impression was very welcoming. Talk about the family waiting area and the business center.
Okay, so we do have an open visiting area for families that are waiting for patients having procedures or surgeries. Then we also created a business center. It's a closed waiting area so people can work on their iPads or their devices while their family members are being taken care of. And then that also leads out to the healing garden. So if they need to take a break and get outside and get some fresh air, they can step outside.
That's incredible. Not only is it technology friendly, but it also, invites the spiritualness of human kindness.
Right. If we don't have beds available, then we do have a triage room there as well. So the nurse can take the patient into triage, and then there's actually an entrance back into the ED, so they don't have to come back out into the public waiting area.
And then we went to the emergency department. It was really interesting to learn about the efficient way you're treating patients. How busy has the emergency room been so far?
So we opened the facility on Tuesday, May 13th. And we have seen approximately 100 patients through the emergency department so far, so we're very happy with that. We've put in place a pool-to-full philosophy, which is when a patient comes into the emergency entrance, as long as we have beds in the emergency department, we just take the patient straight back, and we do triage and register the patient right at the bedside. So we're trying to deliver immediate care as long as we have a bed available.
Well, I tell you what, it was certainly, it was very fluid when we were taking a look at the building and the layout. The Universal Care Unit, I was very impressed with that. Can you tell us about that?
Sure. So the Universal Care Unit is exactly what the name is describing. It's used for different things. So this unit is really designed, if you look in the patient rooms, they're exactly the same as what you saw in the ED. The rooms are set up just like the emergency department. There's 12 beds there as well. And we use those beds in the morning for our pre-op patients and also for pre-admit testing. And then as the day progresses, that's when it tends to get busier in the emergency department. So we're able to then use those beds if we need to for overflow for ED patients. So when you have blood drawn, then we send the little tubes of blood in here. Just between the two units, we have our laboratory and our radiology department. So it's kind of sandwiched between the two units so that the staff have access from either side. So it makes the workflow very efficient for the staff.
Oh, you could just tell how efficient it was. Mm-hmm. And the thing is, you didn't have to walk around a wall. Your access was absolutely just very fluid, how we spoke about earlier.
Equipment, and this is the CT scanner, brand new CT scanner.
Now talk about the radiology department.
Okay, so we have a radiology department. We have a 64-slice CT scanner. We have the ability to do general X-ray, an ultrasound, and some general imaging at the facility. And usually very cold, yes? Because everybody's in a bunch of garb. They have masks and they have gowns on and they have gloves on, and it gets really, really hot.
We next visited surgery. What types of procedures will be performed at St. Joseph's Westgate?
We will be performing general surgery. We're looking to do some orthopedic work there as well, total hips, total knees. We're doing endoscopy procedures and lithotripsy right now.
And like we mentioned earlier, we talked about all your services being connected, specifically your pharmacy. They're on the first floor, correct? Mm-hmm. Making it convenient for your surgery patients. Now let's talk about the inpatient unit up on the second floor. The patients looked really comfortable, and they're very modern as well. Mm-hmm. For example, having the traditional whiteboard online so that patients can track their care and see who's been in and out of their room. And that's very, very innovative and using technology to its highest level. Tell us more about this and the other features of the unit.
Okay, so on the second floor we have 24 inpatient beds. They're all private rooms. The way the architect designed the rooms is that they're at an angle, so the patient can actually see out the window, which promotes healing because they get that natural light. And then we do have flat screen TVs in all the patient rooms, and we are utilizing Get Well Network, which is a program where They can watch movies, they can play games, but it's also an education tool for the patient and the families. So there's education material about their diagnosis, there's information about the medications and the side effects of what they're taking, and as you mentioned, the whiteboard. So a whiteboard is a communication tool for all of the providers to the patient to know what the plan of care is and what they can expect throughout the day. So what we've done is we've put that on the Get Well network, and then we are photographing all of our providers so that the patient knows. You know, we all tend to look alike as we run around in our scrubs, right? So we want the patients to know who's taking care of them. Is it who their doctor is, who the nurse is, who the tech is. So we're going to be uploading all of those photographs. So as providers come in the room, we'll ask the patient to pull up their whiteboard so that we can talk about the plan of care for the patient. So it keeps everybody in the loop for what the plan of care is for the patient.
And also in reference to instant access to your patient, and the patient instant access to the nurses and services. The nurses station is there as well, correct?
Right, so we have, the unit is divided kind of in half, so there's 12 beds on either end, and we have a nurse station at both ends of the unit. We have telemonitoring tech who's there 24/7 to monitor our patients. We also utilize teletracking, which is a patient tracking board, which really helps the nurses to know which patients are coming, maybe from the emergency department or from the operating room. It helps us control our throughput and our patient flow as well, so it's all automated.
And when we talk about therapy, therapy is a very integral part of healing. I noticed that you have a therapy gym there as well. Is that right?
Yes, so we hope to open our therapy gym as we start to do some orthopedic work. So it's just a private area for the patient to work with the physical therapist towards recovery.
And inquiry minds want to know, is it too early to ask about your plans for expansion?
You know, so I think I mentioned earlier, the next construction that will begin is the medical office building, which will be on the north end of the campus, which we hope to open in the fall of 2015. So that will house medical offices for community physicians and also outpatient surgery.
And what I wanted to note also, just a simple note, if you're on the freeway and you're headed north and you look west, you can actually see the footprint of the property that the hospital has grown, and it's an incredible size. Tina, just a real quick statement and question. When we were leaving the rooms on the second floor waiting for the elevator, we turned to our right and there was this beautiful collage of the history of St. Joseph's. And when I was asking you about it and before we got on the elevator, before you could even answer, there were the Sisters of Mercy who helped start the hospital. Can you tell us a little bit about that?
Right, so that's our second floor waiting area, and we've really dedicated that area to the Sisters of Mercy who founded St. Joseph's 119 years ago. So what we did is we worked with the art vendor that we chose, and we had the Sisters of Mercy pick out some photographs, and we had them do a collage of their history. And so that room is really dedicated to be a quiet place for healing for family members to go and just sort of meditate if they need to. So we actually took the TV out of that room and really tried to make it a quiet place and dedicate it to the work that they've done.
That was a perfect way to end the tour, and if you didn't know better, it was planned, but it was totally impromptu with the sisters being there. Tina, thank you so much for being my guest today. St. Joseph's Westgate Medical Center will be such an asset to Glendale residents and everyone in the West Valley. You are an essential partner with the City of Glendale, and I look forward to working with you in the future.